These include obesity, diabetes, heart disease, cancer, and brain diseases like Alzheimer's. Here's the magic. When you don't eat for a while, your body goes into a special mode. There is literally a metabolic switch that occurs when you fast. To do this, your cells activate a multitude of processes to protect themselves and to repair any damage. They also get better at using energy efficiently. Do you know how amazing this is? This is literal biohacking. Exercise can actually boost these effects. When you combine fasting with exercise, your body becomes even more resilient to stress and disease. After you eat, your body switches back to using sugar for energy. It uses this time to grow and repair tissues. If you regularly practice intermittent fasting, your body can adapt to this cycle. This can lead to so many long-term health benefits: improved brain function, better physical performance, and a stronger immune system. The three most widely studied, but not the only versions of intermittent fasting regimens in humans are alternate day fasting, 5-2 intermittent fasting, fasting 2 days each week, and daily time-restricted feeding. I personally do the daily time-restricted feeding. I do 18 and 6. I fast from food for 18 hours and I eat for 6 hours during a 24-hour period. Why? Before, it kept my inflammation down because of my MS. But more recently, actually, I tripped and I broke my finger. This finger. Because I fasted often in the past, I rarely experienced pain. But actually, this Halloween, this year, I guess I just lost my mind. I was experiencing piercing pain that was waking me up at night. I decided I'm going to fast. So I did an 18-6 fast, that 24-hour cycle. I'm not saying I'm healed, but I did not experience any pain that night or the next day. I told you I'm my own patient most of the time. Why do I do the 18 and 6? I do that because when you're in a fasted state for more than 17 hours, your body goes into autophagy. And autophagy is a natural process that occurs in your cells. It's like your body's cellular recycling system, breaking down and recycling your old damaged cell components. Why is autophagy important? Autophagy plays a crucial role in maintaining cellular health and preventing diseases. Here are some of the key benefits. Cellular health. It removes damaged cell components and reducing cellular stress and preventing disease. Disease prevention. It's linked to reduced risk of neurodegenerative diseases like cancer and other age-related conditions. Immune function. It helps regulate immune responses and fight infections. Aging. It contributes to healthy aging by promoting cellular repair and renewal. Stay tuned for the rest of the story on intermittent fasting, the multiple benefits of intermittent fasting, and practical tips on how to incorporate it in your daily life. Here are some benefits of intermittent fasting. Here are some of the benefits or effects or byproducts of intermittent fasting. Intermittent fasting and stress resistance. Our ancestors didn't have the luxury of 3 square meals a day and a couch to lounge on. They had to hunt and gather, often going long periods of time without food. Over time, our bodies adapted to this intermittent fasting lifestyle. When we fast, our bodies go into kind of a survival mode. Our cells start repairing themselves, cleaning out damaged parts, and becoming more efficient. This process, called autophagy, is like our body's cellular spring cleaning, so to speak. You can think of it like this. When you clean your house, you throw away old stuff, and you fix broken things, and you make everything more organized. Autophagy does the same thing for your cells. By regularly fasting, we can reap the benefits of this cellular cleanup. It can help improve our overall health, boost our immune system, and protect us from diseases like Alzheimer's disease and Parkinson's disease. So while it might seem counterintuitive, fasting can actually be a powerful tool for improving our health and longevity. Reducing calories can increase lifespan, but the results can vary. Factors like age, sex, and genetics play a role. Intermittent fasting, where you alternate between eating and fasting periods, has shown promise in improving health. It can help with weight loss, blood sugar control, and reducing inflammation. From the same study in the New England Journal of Medicine, intermittent fasting interventions ameliorate or get rid of obesity, insulin resistance, dyslipidemia, hypertension, and inflammation. Intermittent fasting seems to confer health benefits to a greater extent than can be attributed just to a reduction in caloric intake. Specific quote for MS: multiple sclerosis is an autoimmune disorder characterized by axon demyelination and neuronal degeneration in the central nervous system. Alternate day fasting and periodic cycles of 3 consecutive days of energy restriction reduce autoimmune demyelination and improve the functional outcome in a mouse model multiple sclerosis. Experimentally induced autoimmune encephalomyelitis. 2 recent pilot studies shows that patients with multiple sclerosis who adhere to intermittent fasting regimens have reduced symptoms in as short a period as 2 months. That is major. Physical and cognitive effects of intermittent fasting. Intermittent fasting, where you cycle between periods of eating and fasting, can have some surprising benefits for your physical and mental health. The physical benefits are improved endurance. Studies have shown that intermittent fasting can boost your endurance, making it easier to exercise for longer periods of time. It gives you enhanced muscle mass. Even while losing weight, you can maintain or even increase muscle mass, strength training, and intermittent fasting. There are also mental benefits: a sharper mind. Intermittent fasting can improve cognitive function, including memory, focus, and problem solving. You also have a reduced risk of neurodegenerative diseases by reduced inflammation and oxidative stress. Intermittent fasting may help protect against these conditions like Alzheimer's disease or Parkinson's disease. While more research is needed, especially in older adults, the potential benefits of intermittent fasting are promising. If you're considering trying intermittent fasting, it's so important you consult with your healthcare provider to ensure it's safe and appropriate for you. Clinical applications: obesity and diabetes mellitus. In animal models, intermittent feeding improves insulin sensitivity and it prevents obesity caused by high-fat diet and ameliorates diabetic retinopathy. On the island of Okinawa, the traditional population typically maintains a regimen of intermittent fasting and has low rates of obesity and diabetes mellitus, as well as extreme longevity. Okinawans typically consume a low-calorie diet from energy-poor but nutrient-rich sources, particularly Okinawan sweet potatoes, other vegetables, and legumes. Likewise, members of the Calorie Restriction Society who follow the CRON, or the Calorie Restriction with Optimal Nutrition diet, have low rates of diabetes mellitus with low levels of insulin-like growth factor 1, growth hormone, and markers of inflammation and oxidative stress. Cancer. Studies on skipping meals and cancer are underway. Early research has focused on making sure people can stick with these plans and checking for any side effects. Some studies, like one looking at daily calorie restriction in men with prostate cancer, found great compliance, Almost everyone stuck to the plan and no problems. There have also been reports of individual cases where skipping meals might help shrink tumors and even extend life for people with brain cancer. Right now, there are ongoing studies listed online, like a big medicine library, that are looking at skipping meals in people with breast, ovarian, prostate, and other cancers. These studies are all trying different ways of skipping meals, but all involve doing it while people are on chemotherapy. The important thing to note is that we don't yet know if skipping meals can stop cancer from coming back. Okay, here's the pharmacist advice. If you're interested in skipping meals as part of your cancer treatment, talk to your doctor first. They can help you find the safest and most effective approach for your particular situation. Neurodegenerative disorders. Eating too much, especially as we get older, can increase our risk of serious health conditions like stroke, Alzheimer's disease, and Parkinson's disease. Studies on animals have shown that intermittent fasting, where you cycle between periods of eating and fasting, can help protect the brain. It can improve brain cell health, reduce inflammation, and help prevent cell damage. While there's promising research, we still need more studies on people to confirm these benefits. Ideally, we'd start these studies early on before people develop severe symptoms. If you're concerned about your brain health, talk to your doctor. They can help you determine if intermittent fasting might be a good option for you. All right, asthma, multiple sclerosis, and arthritis. Literal quotes from the study. Asthma. Weight loss reduces the symptoms of asthma in obese patients. In one study, patients who adhered to the alternate day fasting regimen had an elevated serum level of ketone bodies on energy restriction days and lost weight over a 2-month period, during which asthma symptoms and airway resistance were mitigated. A reduction in symptoms was associated with significant reduction in serum levels of markers of inflammation and oxidative stress. Multiple sclerosis. Multiple sclerosis is an autoimmune disorder characterized by axon demyelination and neuronal degeneration in the central nervous system. Alternate day fasting, periodic cycles of 3 consecutive days of energy restriction reduce autoimmune demyelination and improve the functional outcome in mouse model multiple sclerosis. 2 recent pilot studies shows that patients with multiple sclerosis who adhere to intermittent fasting regimens have reduced symptoms in as short a period as 2 months. Rheumatoid arthritis. Because it reduces inflammation, intermittent fasting would also be expected to be beneficial in rheumatoid arthritis, and indeed, there is evidence supporting its use in patients with arthritis. If you are going to take advantage of this tool, you have to do some things first. I'm going to give you some very practical tips and considerations before starting. Starting intermittent fasting, I'm going to provide you practical tips for beginners, such as starting slowly and gradually increasing your fasting periods. Monitor your body. Discuss the importance of listening to your body and adjusting your fasting schedule as needed. Switching to an intermittent fasting regimen, many people will experience hunger, irritability, and reduced ability to concentrate during periods of food restriction. However, these initial side effects usually disappear within 1 month, and patients should be advised of this particular fact, and I'm advising you. Consulting with your doctor, pharmacist, dietitian, or nutritionist prior to initiation of intermittent fasting. I want to emphasize the importance of consulting with a healthcare provider before starting any new diet or lifestyle change. Your doctor or pharmacist need to be talked to because they may have to adjust dosing of some of your medications. For example, Type 2 diabetics, because your insulin sensitivity will increase as a result of fasting, your blood glucose will begin to normalize. If you continue to take your previously prescribed anti-diabetic medication for your previous blood glucose, you could experience hypoglycemia. That's a medical emergency. Nutritionists and dietitians ensure that your nutritional needs are being met. You need a plan. How are you going to do this? What are you going to do if you are the only one in your house doing this? Which fasting regimen are you going to follow? You have to consider all of these things. Thank you very much for watching. I really appreciate your time. I hope you got value from this video. I would like you to consider subscribing, liking the video, and commenting, and turning on your notification bell so you'll know when the next video is posted. Thank you very much. Be well and choose joy.